The concepts of ethics and morality in nursing are not just theoretical ideas, but practical tools that guide us daily as we navigate complex and sensitive situations with our patients, families, and colleagues. Understanding ethics and morality helps us make decisions that align with our professional standards and values, ensuring the best possible care for our patients. Ethics refers to the study of morality and how it applies to human behavior. It helps us understand what is right and what is wrong, and sets the standards for moral behavior within a specific group, such as our nursing practice. Nursing ethics focuses on the unique challenges we face in our profession, like patient confidentiality, informed consent, and end-of-life care. For example, in the Philippines, where family-centered care is common, nurse must often balance patient autonomy with the family's input. This contrasts with countries like the US, where patient autonomy is prioritized. These cultural differences highlight the importance of ethical principles tailored to your patient's context. What is morality? Morality refers to a personal standards of what is right and wrong. These are influenced by culture, religion, and personal experiences. For us nurses, morality often manifests as an inner voice, guiding us to act ethically, especially in challenging situations. For instance, if you are a Filipino nurse caring for a patient who refuses treatment due to faith-based beliefs, you may feel torn between respecting your patient's decision and the moral duty to save lives. Ethics and morality are related but distinct concepts. Ethics involves a broader study of moral principles, while morality pertains to personal standards. Understanding this difference is crucial for nurses to navigate professional and personal conflicts. For example, a nurse might question the morality of withdrawing life support from a patient in a vegetative state. Ethically, the nurse must respect the family's decision if it aligns with medical guidelines and the patient's advance directives. This distinction is critical in balancing professional accountability and personal beliefs. Ethics and law often intersect but are not always aligned. Laws reflect societal moral values but may not fully encompass ethical nuances. For example, in the country, euthanasia is illegal. However, ethically, some nurses may feel that prolonging life through invasive measures contradicts the principle of beneficence or doing good. In countries like the Netherlands, where euthanasia is legal under strict conditions, nurses must still navigate ethical principles. That is to ensure that the patient understands their options fully. Ethics and religion often influence each other, but serve different purposes. Ethical principles are universal laws, but are secular, while religious beliefs are specific to faith communities. This distinction is vital in diverse settings. For example, a Jehovah's Witness patient may refuse a blood transfusion due to religious beliefs. The nurse must respect this decision while exploring alternative treatments that align with ethical principles of beneficence and non-maleficence. Moral development is the process of learning to distinguish right from wrong. It begins in our childhood and evolves through our experiences, education, and reasoning. There are two prominent theories of moral development, and they are by Lawrence Kohlberg and Carol Gilligan. In the Philippine context, moral development often incorporates strong familial and religious influences, emphasizing care and responsibility, which aligns with Gilligan's theory. Meanwhile, Western countries may focus more on individual rights, reflecting more on Kohlberg's principles. Kohlberg's theory identifies three levels: pre-conventional, conventional, and post-conventional. Each stage represents a deeper understanding of moral reasoning. For instance, a Filipino nurse in the pre-conventional stage might follow rules to avoid punishment. At the conventional level, they may uphold societal norms like respecting authority. At the post-conventional stage, they prioritize universal ethical principles, such as advocating for patients' rights despite institutional barriers. Gilligan's theory of moral development emphasized care and relationship over rules and rights. Her theory resonates with the Filipino value of bayanihan or communal unity, where decisions often consider the well-being of the group. For example, a nurse working on a rural health unit might prioritize community health by organizing vaccination drives, showing care for the collective rather than focusing solely on individual patients. Moral frameworks provide structured approaches to ethical decision making. Three main types are consequence-based, principles-based, and relationships-based frameworks. Each framework offers a unique perspective. For example, in the Philippines, a nurse may use a relationships-based framework to strengthen trust with a patient's family during end-of-life discussions, while a nurse in a Western hospital might focus on principles-based reasoning to respect patient autonomy. The consequence-based framework judges actions by their outcomes. Utilitarianism, a common approach, seeks the greatest good for the greatest number. For example, in our country, during typhoons or disasters, the Filipino nurses might prioritize resources for patients with the best chances of survival. In contrast, a similar approach might guide pandemic responses worldwide, such as vaccine distribution. The principles-based framework emphasizes rules, duties, and rights. Nurses following this framework act based on ethical principles like autonomy and justice. For example, a nurse might assist in obtaining informed consent for a procedure, respecting the patient's autonomy despite familial pressure to proceed with it. The relationships-based framework focuses on nurturing relationships and promoting the common good. A nurse providing emotional support to a family during a terminal illness demonstrates this approach, prioritizing care and connection over rigid rules. What are moral principles? Moral principles provide foundational guidance for ethical decisions. Key principles include autonomy, beneficence, non-maleficence, justice, fidelity, and veracity. These principles are universal but must be adapted to cultural contexts. Let us explore each of them. Autonomy refers to the patient's right to make decisions. We must respect this, even when they disagree with our decision. For example, a patient might refuse dialysis for whatever reason, and this should be respected. Globally, respecting autonomy might involve supporting a patient's decision to withdraw from a clinical trial. Non-maleficence means avoiding harm. This principle can be challenging when interventions carry risks. For instance, when we administer chemotherapy, this may cause severe side effects, but they could also save lives. We as nurses must weigh these risks carefully, ensuring our patients are well informed. What is beneficence? Beneficence is the obligation to do good. This principle often guides health promotion efforts. Every time we conduct health education campaigns in underserved communities, we exemplify beneficence. Or when we advocate for policies that improve access to health care, that is beneficence. Justice, on the other hand, focuses on fairness in care and resource allocation. Here in the country, we nurses often face challenges in distributing limited resources. But this should not prevent us from practicing and observing justice. Fidelity means being faithful to promises and responsibilities. For example, if you promised a patient to follow up on their pain management, fidelity requires ensuring this happens regardless of other priorities. Veracity or truth-telling is critical for building trust. For example, explaining a poor prognosis honestly to a patient while offering hope demonstrates veracity. In some culture, this must be balanced with family preferences to shield the patient from distressing information. Nurses must be accountable for their actions and recognize their professional responsibilities. This includes documenting care accurately and justifying decisions based on evidences and on ethical standards. Ethical principles must be adapted to cultural religious contexts. For instance, a Muslim patient might require gender-specific care, and a Jehovah's Witness may refuse blood transfusion. Nurses must respect these values while ensuring patient safety. Patient-centered care involves listening to our patients' values and preferences. For example, we are often involved in families in care planning, while in Western settings, the focus may shift to empowering the patient directly. Ethical dilemmas often arise in practice, such as balancing patient confidentiality with family inquiries. Using moral frameworks and principles can guide nurses to make decisions that align with both professional standards and patient care. In conclusion, ethics and morality are vital in nursing practice. By understanding moral frameworks and principles, we can navigate complex situations with integrity and compassion. Whether in the Philippines or abroad, let us strive to provide care that is ethical, respectful, and culturally sensitive.